8 medications doctors avoid taking. The 7th is shocking. Have you ever stopped to think that some widely prescribed drugs can pose health risks? Could it be that taking a medicine for a long time can end up causing more problems than solving? And if these drugs weren't the best solution to treat certain conditions, what could be done? Many people blindly trust the drugs without considering the risks of prolonged use. However, doctors and experts know that some medications should be avoided whenever possible, as they can bring serious side effects, addiction, and even worsen long-term health problems. Today, we're going to talk about 8 medications that many doctors avoid taking and the reasons behind this decision. Most importantly, we will discuss safer and more effective alternatives to take care of your health. Stay until the end, because Medicine 7 is the most dangerous and several people use it daily. Let's get started. What makes certain drugs dangerous even though they are prescribed? Many believe that because they are prescribed, the drugs are always safe. But the reality is different. Some drugs can cause serious side effects, interact negatively with other drugs, and even generate dependence. In addition, prolonged use can compromise vital organs, such as the liver and kidneys. Therefore, understanding the risks of each medication is essential. Is your treatment really safe? Find out now. Are there safer alternatives for treating chronic diseases? Yes. Many chronic conditions can be managed with changes in diet, exercise, and natural therapies. In addition, less aggressive treatments, such as supplements, herbal medicines, and integrative approaches, offer safe and effective alternatives. Reducing reliance on medications can improve your quality of life and prevent complications. What can happen to your body if you take these drugs for too long? Continuous use of certain medications can have devastating effects. Dependence, resistance, overload on the liver and kidneys, as well as neurological damage, are just some of the risks. Many drugs control symptoms, but do not treat the cause of the disease, requiring increasingly higher doses. The problem? Your body can pay a high price for it. Is it worth taking the risk, or is it time to review your treatment? Do you really need this drug, or are there safer alternatives? Taking medicine without assessing risks can compromise your long-term health. Many treatments can be adjusted to avoid severe side effects and even reduce chemical dependency. If your medication is bringing more problems than solutions, it may be time to re-evaluate. 8 medications doctors avoid taking. The 7th is shocking. 1. The hidden danger of the world's most widely used painkillers. Are you at risk? Anti-inflammatory painkillers are one of the most consumed drugs in the world. They promise quick relief for muscle pain, joint pain, and even fever. But do you know the hidden risks behind the prolonged use of these drugs? Drugs such as ibuprofen, diclofenac, and naproxen belong to the group of non-steroidal anti-inflammatory drugs known as NSAIDs. They work by blocking inflammatory substances in the body, reducing pain and swelling. However, this action can come at a high cost to your health when used for long periods. One of the biggest dangers of overusing these painkillers is in the heart. Studies show that people who take NSAIDs for a long time have an increased risk of suffering heart attacks and strokes. This is because these medications can raise blood pressure, affect blood clotting, and overload the cardiovascular system. Another serious problem involves the digestive system. The continuous use of anti-inflammatory drugs can cause gastritis, ulcers, and even bleeding in the stomach. Many cases of hospitalization for digestive bleeding are directly linked to the indiscriminate use of these medications. If you've ever experienced stomach pain when taking a pain reliever, this could be a warning sign. The kidneys also suffer from long-term use of NSAIDs. These medications can reduce blood flow to the kidneys, impairing their functioning and, in extreme cases, leading to kidney failure. People with a history of kidney problems should be even more careful when using these drugs. In addition to these risks, there is an effect that few people know about. The chronic use of painkillers can lead to a rebound effect. That is, instead of relieving pain, the body may start to feel more pain over time. This happens because the body adapts to the medication, making it less effective and causing the person to need larger and larger doses. If NSAIDs can be so harmful, why do they continue to be widely used? The answer lies in the ease of access and the lack of information. Many people buy these drugs without a prescription, believing that they are completely safe. However, doctors and specialists know that indiscriminate use can have serious consequences. But then, what are the alternatives to relieve pain without taking these risks? Depending on the source of the pain, therapies such as physical therapy, acupuncture, and light exercise can bring excellent results. Additionally, techniques such as meditation and progressive muscle relaxation can help reduce chronic pain without the need for medications. In some cases, less aggressive painkillers, such as paracetamol, may be a safer option, as long as they are used sparingly. However, the most important thing is to treat the cause of the pain, and not just mask the symptoms. Now that you know the dangers of anti-inflammatory painkillers, is it worth continuing to take these drugs without medical supervision? Or would it be better to look for safer alternatives for your health? 2. The truth about statins, the cholesterol drug that can do more harm than good. Statins are widely prescribed to lower cholesterol and prevent cardiovascular disease. Millions of people around the world use these drugs daily. But what many don't know is that doctors and experts are increasingly questioning the risks of long-term statin use. Are these drugs really indispensable for all patients? Statins such as simvastatin, atorvastatin, and rosuvastatin act by reducing the production of cholesterol by the liver. While they may be effective at lowering bad cholesterol, LDL levels, their actual impact on long-term health is still up for debate. One of the biggest problems associated with statins is myopathy, a side effect that causes muscle pain, fatigue, and weakness. Some people report difficulties performing simple activities, such as climbing stairs or carrying light objects, due to loss of muscle strength. In rare cases, long-term use can lead to rhabdomyolysis, a serious condition that can cause kidney damage and even lead to kidney failure. In addition, studies indicate that continued use of statins may increase the risk of developing type 2 diabetes. This is because these medications can interfere with insulin function, raising blood sugar levels. For people who are already predisposed to diabetes, this can be a real concern. Another point that raises doubts about the indiscriminate use of statins is the impact on the brain. Some people report cognitive difficulties, such as memory loss and difficulty concentrating, after starting treatment. Although these effects usually disappear when you stop using the drug, they can significantly affect quality of life. If statins pose so many risks, why are they still widely prescribed? The answer lies in the way studies on these drugs are interpreted. A lot of research shows that statins can reduce the risk of cardiovascular events by 30% to 40%, but these numbers can be misleading. In reality, for every 100 people who take statins, only 1 or 2 actually benefit from reducing a cardiac event. This means that many people may be taking this medication without a real benefit and still experiencing its side effects. In the face of these concerns, doctors are increasingly recommending lifestyle changes as an alternative to statins. Adopting a balanced diet rich in fruits, vegetables, and healthy fats can be an effective way to lower cholesterol naturally. Regular physical exercise, such as walking and resistance training, also helps to keep cholesterol levels in check. In some cases, natural supplements such as omega-3, berberine, and phytosterols can be allies in lowering cholesterol without the side effects of statins. However, it is always essential to consult a doctor before making any changes in treatment. If you use statins, it may be time to reevaluate that decision. Does the benefit of the drug really outweigh the risks? Or can small changes in routine be a safer and more effective alternative? 3. Sleep medications. Why can they make your insomnia worse without you realizing it? A good night's sleep is essential for health, but many people suffer from insomnia and resort to sleep medications. Drugs such as zolpidem, ezopiclone, and benzodiazepines are widely prescribed to help people fall asleep faster. However, what few people know is that prolonged use of these medications can be dangerous and, in some cases, make insomnia even worse. Sleep medications act on the central nervous system, promoting relaxation and inducing sleep. At first, they seem like a magic solution for sleepless nights. But the problem arises when the body begins to develop tolerance to the drug, which means that the dose needs to be increased to achieve the same effect. This can lead to dependence, making it increasingly difficult to sleep without the medicine. Another serious risk of continuous use of these drugs is the so-called rebound effect. Many people who try to stop taking sleeping pills face an even stronger return of insomnia, making the process of quitting the medication extremely difficult. This creates a vicious cycle in which the person feels that they can no longer sleep without the medication. In addition to dependence, these drugs can cause worrisome side effects. Many people report excessive daytime sleepiness, dizziness, difficulty concentrating, and even episodes of temporary amnesia. Cases of sleepwalking induced by sleep medications are also common, with reports of people driving or even preparing food through the night without remembering anything the next day. The risk of falls and accidents also increases, especially in the elderly. Studies show that people who take these medications regularly have a much higher risk of suffering fractures due to falls. This is because the drugs can affect balance and motor coordination, even the day after use. But if sleeping pills can cause so many problems, what's the alternative? The good news is that there are natural and effective ways to improve sleep without resorting to medications. Practices such as sleep hygiene, reducing blue light exposure before bed, and regular bedtimes and wake-up times can make a big difference. In addition, relaxation techniques such as meditation and deep breathing help reduce anxiety and prepare the body for restful sleep. In some cases, natural supplements such as melatonin, magnesium, and valerian can be helpful in improving sleep quality without the risks of conventional remedies. Insomnia is often a symptom of something bigger, such as stress, anxiety, or hormonal problems. Instead of masking the problem with medications, looking for the root cause of the problem may be the key to a lasting solution. Now that you know the risks of sleeping pills, is it worth continuing to depend on them? Or would it be better to explore more natural methods to improve your sleep safely and effectively? 4. The pitfall of diabetes. Drugs that can cause amputations. Type 2 diabetes is one of the most common chronic diseases in the world, and many patients turn to medications to keep glucose levels in check. Among the most prescribed drugs are SGLT2 inhibitors, such as dapagliflozin and empagliflozin. These medications help eliminate excess glucose in the urine, but are they really safe in the long term? SGLT2 inhibitors may be effective for lowering blood sugar levels, but their mechanism of action has a worrisome side effect: increased risk of urinary and genital infections. Because these medications cause sugar to be excreted through the urine, they create an ideal environment for bacteria and fungi to proliferate. Recurrent infections can be a big problem, especially in women and the elderly. In addition, these medications can lead to dehydration and excessive sodium loss in the body. This can cause dizziness, falls, and even diabetic ketoacidosis, a serious and potentially fatal condition in which the body begins to break down fat in an uncontrolled way, generating a dangerous accumulation of acids in the blood. One of the most alarming side effects associated with SGLT2 inhibitors is the risk of amputations. Studies indicate that people who take these medications for long periods may have a higher risk of developing wounds and infections in the feet and legs, leading, in extreme cases, to the need for amputation. This is because diabetes is already a condition that compromises blood circulation and healing, and the use of these drugs can further aggravate this problem. If these risks are so serious, why do SGLT2 inhibitors continue to be widely prescribed? In some cases, these medications may be helpful for diabetes patients who also have heart or kidney problems. However, for many people, lifestyle changes can be a safer and more effective alternative to controlling blood glucose without the risks of these medications. Eating a balanced diet that is low in refined carbohydrates and high in fiber and protein can help stabilize blood sugar levels naturally. Regular exercise also plays a key role, as it improves insulin sensitivity and helps maintain a healthy weight. Another important point is that there are safer options for treating diabetes. Metformin, for example, is a widely studied drug with a more favorable safety profile than SGLT2 inhibitors. However, the best strategy for each patient should be discussed with a doctor. Now that you know the risks of SGLT2 inhibitors, is it worth continuing to take these drugs without evaluating safer alternatives? Or is it time to rethink your approach to diabetes management and invest in healthier, more effective strategies? 5. Proton pump inhibitors, the heartburn remedy that can compromise your long-term health. If you've ever suffered from heartburn or reflux, you've probably heard of proton pump inhibitors, known as PPIs. Medications such as omeprazole, pantoprazole, and esomeprazole are widely prescribed to reduce stomach acidity and relieve symptoms of gastroesophageal reflux disease. But what few people know is that prolonged use of these drugs can bring serious health risks. PPIs work by blocking the production of acid in the stomach, which helps relieve burning and prevent damage to the esophagus. However, gastric acid plays a key role in the body, helping in the digestion of food and the absorption of essential nutrients. When acid production is reduced for long periods, the body can begin to suffer various consequences. One of the most concerning problems with long-term use of PPIs is vitamin and mineral deficiency. The stomach needs acid to properly absorb nutrients such as vitamin B12, magnesium, and iron. B12 deficiency, for example, can lead to symptoms such as fatigue, mental confusion, and even more serious neurological problems. A lack of magnesium, on the other hand, can cause muscle weakness, cardiac arrhythmias, and frequent cramps. In addition, PPIs are associated with a higher risk of osteoporosis and bone fractures. Since calcium also depends on stomach acid to be absorbed correctly, in the long run, the continuous use of these drugs can lead to a weakening of the bones, increasing the chances of fractures, especially in the elderly. Another important risk is increased vulnerability to gastrointestinal infections. Stomach acid acts as a natural barrier against bacteria and other harmful microorganisms. When its production is reduced, the risk of intestinal infections, such as the one caused by the bacterium Clostridium difficile, increases significantly. This infection can lead to severe diarrhea and even more serious complications, especially in people who are hospitalized or have weakened immune systems. In addition, studies indicate that long-term use of PPIs may be related to an increased risk of chronic kidney disease and even dementia. While the exact relationship is still being investigated, the researchers believe that interference with the absorption of essential nutrients may play a role in these problems. If PPIs pose so many risks, what can be done to control heartburn and reflux without relying on these medications? The good news is that lifestyle changes can make a big difference. Reducing the consumption of acidic, fatty, and ultra-processed foods, avoiding eating late at night, and maintaining a healthy weight are some effective strategies to relieve symptoms. Another option is histamine blockers, such as ranitidine and famotidine, which also reduce acid production, but without the same risks as PPIs in the long run. However, any change in treatment should be discussed with a doctor. Now that you know the dangers of proton pump inhibitors, is it worth continuing to take these medications indefinitely? Or would it be better to look for safer alternatives to protect your digestive health? 6. Antibiotics, the ticking time bomb that is making infections deadlier. Antibiotics have revolutionized medicine and saved millions of lives since their discovery. They are essential for treating bacterial infections, from urinary tract infections to severe pneumonias. However, prolonged or unnecessary use of these medications can have alarming consequences, which is why many doctors avoid taking them unnecessarily. The biggest problem with the indiscriminate use of antibiotics is the development of bacterial resistance. This means that over time, the bacteria become immune to the effect of the drugs, making infections more difficult to treat. According to the World Health Organization, WHO, antibiotic resistance is one of the biggest threats to global health, potentially causing millions of deaths in the coming years. But how does this happen? When a person takes antibiotics unnecessarily or does not follow the treatment correctly, some bacteria survive and become stronger. These resistant bacteria can then multiply and spread, making future infections more difficult to treat. Some infections that were once easily cured with simple antibiotics now require more potent medications, and in some cases, there are no longer effective treatment options. In addition to bacterial resistance, antibiotics can cause imbalances in the gut flora. Our gut is home to trillions of beneficial bacteria that help with digestion, immunity, and even mental health. Long-term use of antibiotics can kill these good bacteria, making room for the uncontrolled growth of harmful microorganisms. This can result in problems such as diarrhea, fungal infections, and even inflammatory bowel diseases. Another worrying side effect of antibiotic overuse is the increased risk of infection with Clostridium difficile, a resistant bacterium that can cause severe diarrhea and colitis, a dangerous inflammation in the gut. In more severe cases, this infection can lead to hospitalization and even be fatal. In addition to the impacts on the gut, antibiotics can also affect other organs. Some types of antibiotics, such as aminoglycosides, can be toxic to the kidneys, leading to serious kidney problems. Others, such as fluoroquinolones, can weaken tendons and increase the risk of muscle tears, especially in the elderly. If antibiotics are so important, how can we use them safely? The answer lies in responsible use. This means that these medications should be taken only when really necessary and always under medical prescription. In addition, it is essential to complete the treatment exactly as directed, even if the symptoms disappear before the end of the course of antibiotics. Prevention also plays a key role in reducing the need for antibiotics. Simple practices such as washing your hands regularly, maintaining a healthy diet, and strengthening your immune system can help prevent infections and reduce dependence on these medications. Now that you know the dangers of long-term use of antibiotics, is it worth taking them unnecessarily? Or is it time to rethink the way we handle these drugs to ensure they remain effective for future generations? 7. Corticosteroids, the miracle medicine that can destroy your body if used wrong. Corticosteroids are often called miracle medicines due to their potent anti-inflammatory action. They are widely used to treat various conditions such as asthma, arthritis, allergies, and autoimmune diseases. However, despite their effectiveness, long-term use of these drugs can bring serious side effects, which is why many doctors avoid taking them for long periods. Medications such as prednisone, dexamethasone, and betamethasone work by reducing inflammation and suppressing the immune system. This can be useful in acute situations, such as severe allergic crises or intense inflammation. However, the continuous use of corticosteroids can lead to serious problems, affecting practically the entire body. One of the most well-known effects of corticosteroids is fluid retention, which can cause swelling and increased blood pressure. People who use these medications for long periods often report swelling in the face, an effect known as full moon face. In addition, fluid retention can lead to heart problems and increased risk of hypertension. Another serious problem with the prolonged use of corticosteroids is osteoporosis. These medications can weaken bones, significantly increasing the risk of fractures, especially in the spine and hip. This is because corticosteroids reduce calcium absorption and interfere with bone formation, making bones more fragile over time. The immune system also suffers from the continued use of these medications. Because corticosteroids suppress the body's inflammatory response, they can leave the body more vulnerable to infections. This means that small infections can become more serious and take time to be fought by the body. In addition, corticosteroids can affect metabolism and lead to weight gain, increased blood sugar levels, and even the development of type 2 diabetes. Many people who make prolonged use of these medications report increased appetite and fat accumulation in the abdominal region, which can contribute to the development of metabolic syndrome. The side effects don't stop there. The prolonged use of corticosteroids can also cause psychological problems, such as insomnia, anxiety, and even depression. Some people report sudden mood swings, irritability, and episodes of euphoria followed by discouragement. If corticosteroids pose so many risks, what can be done to minimize their side effects? First of all, these drugs should be used for the shortest possible time and at the lowest effective dose. When necessary, doctors can opt for inhaled or topical corticosteroids, which have fewer systemic side effects. In addition, natural strategies to reduce inflammation in the body, such as an anti-inflammatory diet rich in fruits, vegetables, and healthy fats, can help reduce the need for corticosteroids. Regular physical exercise and stress management techniques, such as meditation and yoga, can also contribute to reducing inflammation without the side effects of these medications. Now that you know the dangers of corticosteroids, is it worth using them indiscriminately? Or would it be better to look for alternatives to control inflammation and preserve your long-term health? 8. Antihypertensives. The common mistake that can turn your high blood pressure into an even bigger problem. High blood pressure, known as high blood pressure, is one of the most common conditions in the world, affecting millions of people. To control it, many resort to antihypertensive drugs such as losartan, hydrochlorothiazide, atenolol, and amlodipine. However, what few know is that, in some cases, the prolonged and indiscriminate use of these drugs can generate problems as serious as hypertension itself. Antihypertensives are essential for many people, especially those with dangerously high blood pressure. They help reduce the risk of heart attack, stroke, and heart failure. However, hypertension does not always need to be treated with medication alone. In many cases, lifestyle changes can be as effective as or more effective than drugs, without the risks associated with their continued use. One of the main problems with antihypertensive drugs is the excessive drop in blood pressure. When the dose is not adjusted correctly, the patient can suffer dizziness, weakness, and even fainting, increasing the risk of falls and fractures, especially in the elderly. Another common side effect is extreme fatigue. Many patients report feelings of constant tiredness, lack of energy, and difficulty performing simple daily activities. This happens because some antihypertensives reduce blood flow to the muscles and brain, causing this feeling of exhaustion. Diuretics, a common type of medication for high blood pressure, can cause imbalances in potassium and sodium levels in the body. This can lead to cramps, palpitations, and even long-term kidney problems. In addition, the continuous use of diuretics can cause dehydration, a dangerous problem, especially for the elderly. Another worrying side effect of some antihypertensive drugs, such as beta blockers, is the impact on heart rate. These medications can excessively slow the heartbeat, leading to symptoms such as dizziness, shortness of breath, and even risk of severe bradycardia. In addition to the physical impacts, antihypertensive drugs can affect mental health. Some patients report depression, anxiety, and even loss of libido after starting treatment. This happens because certain medications interfere with the brain's neurotransmitters, affecting mood and mood. If antihypertensive drugs can cause so many problems, what are the alternatives? The good news is that many people are able to control their blood pressure through lifestyle changes. A diet rich in fruits, vegetables, and healthy fats, combined with reducing salt consumption and ultra-processed foods, can help reduce blood pressure naturally. In addition, regular physical activity, such as walking and resistance exercise, strengthens the heart and improves blood circulation. Relaxation techniques, such as meditation and deep breathing, can also be effective in controlling blood pressure. Does this mean that no one should take antihypertensives? No. For many people, these medications are essential. However, the decision to use them should be made with medical supervision, taking into account the benefits and risks. Now that you know the possible dangers of antihypertensive drugs, is it worth depending only on medications? Or would it be safer to seek a balance between medical treatment and healthy habits to keep the pressure under control? Taking care of your health goes far beyond simply taking medication. Although many drugs are essential in certain situations, prolonged and indiscriminate use can have unexpected consequences. Now that you know the risks of some of the most common medications, it's time to reflect. Do you really need to take them? Or are there safer alternatives? Lifestyle changes, such as healthy eating, exercise, and stress management, can be as effective as many medications, and without the side effects. Seeking knowledge, questioning prescriptions, and talking to health professionals are fundamental steps for a safer and more balanced treatment. Your health is in your hands. You have the power to make smarter choices and ensure a better quality of life. Don't rely solely on medications. Invest in habits that really promote well-being and longevity. What can you start changing today to take better care of your health?